talking about sleep apnea. One of the main tests I would imagine that you have to have is a sleep test. And I'm just thinking that although it may sometimes be necessary to go to the hospital, if you don't have to do that, then it would be probably preferable. You don't want to be somewhere you don't know people and people are watching you and you're hooked up to wires and everything. You actually have a home test now that you can send home with people.
We do. We have it's called a home sleep test. And you're right. So I've done the sleep test. I've done it up at the hospital. It's a great service, but it is a little uncomfortable. You're sleeping, someone's watching you. You've got 20-something wires hooked up to you, and then they say, all right, go to sleep. Yeah. Yeah. And so what we offer is this little device. It's called, it's made by Itamar. It's called the Watch Pat. It goes on your wrist like a watch, and you just push start. You put this little sensor on your finger. There's actually one more sensor that comes right here, and that's it. You push start, you sleep. When you're done, you bring it back into us, and we can kind of download the data, and it tells us how many times you stop breathing, because that's what sleep apnea is you're actually stopping breathing, like someone's got a pillow over your face and you don't really know it, right, but you're having these episodes where you're not getting a good night's sleep, and it's affecting your partner who you're sleeping next to. They're not getting a good night's sleep because you're probably snoring, right, and that sort of thing. And so if we can help identify those people who have sleep apnea, that's what we're all about. If we can help prevent it and treat it.
What about cost comparisons between maybe a hospital stay and being able to take this little thing home?
So it's much less. I was kind of, you shouldn't be shocked about medical costs anymore for what they're doing, but the home sleep test is definitely much less than a full night sleep study.
Okay. And generally speaking, will insurance pay for this?
Typically not. Whereas up at the hospital, yeah, you could probably get your health insurance to cover it, but deductibles nowadays are pretty high. So
this is probably less than having to pay a deductible?
Oh yeah.
So it's going to give us all the information we need. Just to really, let's hold it up and have it's quite a little sci-fi unit there.
Star Trek, here it is.
There it is, right there. Yeah. But really good results.
Yeah, very accurate. It's 90% accurate to the polysomnogram that you would get at a hospital.
Okay, so great little thing. Pop it on my wrist maybe, and we'll let everybody see that it's just a really easy thing to do. We're going to pop it on the wrist. You're going to have this on your, this is presumably going to be tight.
Yep, we're going to buckle it up.
Yep.
Just like a watch.
That would not be difficult to sleep in.
No, not at all.
In comparison to 20 or 30 leads and tubes and things attached to you. Right. Come in and see everybody here at Aspen Dental. They're going to be able to help you. Thanks again.
Thank you.